Hip arthroscopy is really a minimally invasive way to access the hip joint to perform surgical procedures. It's generally done through 2 or 3 small little 1 centimeter incisions. And this is really in contrast to traditional procedures that require large incisions and oftentimes dislocation of the hip joint to actually perform the surgery.
One weekend in October, I did a 25-mile training run. The next weekend was a second-degree black belt test, which is like a marathon. And then the weekend after that was the actual Marine Corps marathon, which I managed to complete. And it went kind of downhill after that. I think I really overdid it a bit.
Yeah, Jeff has an interesting problem called femoroacetabular impingement, which is a process where the hip joint develops a little bit abnormally and there's actually bone spurs around the socket and the ball of the hip joint. And over time, those abnormal bone spurs create a lot of cartilage damage inside the hip joint. So Jeff's procedure was designed to correct the cartilage damage and repair the cartilage damage, and in addition to that, remove the bone spurs that are creating the damage.
At some point, you have to make a decision that you don't want to live in pain anymore. The worst thing for me was bending. Trying to stand over the sink and brush my teeth, where you just bend a little bit, was horrible. As I was sliding downhill physically, I went from being able to do 200 sit-ups in 2 minutes to being able to do 0 sit-ups just because it was so painful throughout my hips.
The vast majority of hip conditions really are strains and sprains, which you would expect. Those typically resolve within the matter of a couple of weeks. For people who have persistent pain, especially that's present for longer than several weeks, especially if it's on the front portion of their hip joint in kind of the groin area, those people oftentimes are the ones that have cartilage tears in their hips and more serious conditions than the normal strains and sprains. So generally, if things don't resolve within a couple of weeks and you have pain on the front portion of your hip joint, it's good to see an orthopedic surgeon.
After consulting with Dr. Parker, we decided that both of my hips had a problem. Now, Dr. Parker is great. He doesn't tell you you have to have surgery on this or that or the other. Dr. Parker really spent a lot of time with us explaining exactly what he thought the problem was, what he thought the potential solutions were, what the risks and possible benefits of surgery might be.
Traditionally, the same procedure was performed through a large incision that required dislocation of the hip, and after those procedures it created a lot of scar tissue and also a particular problem called avascular necrosis a lot of times that was inherent in dislocating the hip joint. Through the newer minimally invasive techniques, we can avoid the excessive scar tissue that used to form and also avoid the chances of getting what's called avascular necrosis. Rehab in general is dictated again by the procedure performed. For instance, Jeff's procedure required actually a fairly lengthy recovery time to allow for bone healing and cartilage healing. There are arthroscopic procedures that allow you to bear weight initially right away and play sports about 4 to 6 weeks afterwards. So there's a lot of variation in the recovery time depending on what's actually done through the arthroscopic procedure.
It's now been about 3.5 months, and he cleared me for spin after 2 months, which was great. I got to get back on the bike and start getting back in physical condition. And I was able to do the Wounded Warrior Project ride called the Soldier Ride, and part of my philosophy of doing well by doing good was able to raise some money for that project, which was great. And then last visit, he cleared me to go ahead and play. He said, yeah, there's still some scar tissue in there. You need to break it up, and the best way to do that is just to get out there and start using it again. So I'm very excited. I'm back out on the racquetball court and playing again and really doing quite well.